things that cause muscular injuries to the low back include twisting or bending or violent maneuvers that would exert a force on the muscles. You can have a sudden contraction and you can injure either the rotators of the lumbar spine, the oblique muscles. You can injure the forward flexors of the lumbar spine, the abdominal muscles, or the hip flexor muscles, or you can also injure the lumbar extensors as well too, including your gluteal muscles. Often this could be due to the fact that the patient may be deconditioned or the muscles aren't properly trained. Usually the symptoms of muscular injuries include localized low back pain. Usually we do not see a large radiating component to the legs. We don't usually see numbness or tingling or weakness, but usually it could be either a stiffness or an aching pain. Sometimes, honestly, the worst type of pain that we see coming into our office is due to just muscle spasm, and it can be a very sharp knife-like pain as well too. Usually we see that the patient's range of motion as far as bending forward and bending backwards is significantly limited by this. And usually the patient can pretty much localize where the pain is.
For an evaluation regarding a muscle-related injury, it's very similar to any other evaluation. We're doing a full functional evaluation. We're evaluating for flexibility issues, and we're essentially watching the patient move with their activities to try and figure out what aggravates this area. So palpation, in addition to evaluating the skin temperature and so on and so forth, and redness can also give an indication that there might be underlying muscular injury. One of the most important muscles that I found that can get injured with low back problems is the iliopsoas, which runs from your lower back through your pelvis and attaches to your inner thigh. And this muscle is the main hip flexor. So when it is tight and you have difficulty extending yourself back because of it, then you put additional pressure on your lower back. Vice versa, if you have really tight hamstrings in the back part of your leg, then bending forward is limited by your hips, and then you put additional forces bending forward in your lower back. So now we're going to have you rotate to the left, and now add the hips in, and rotate to the right, and now add the hips in. Once again, you can kind of see where you can rotate a lot more when you add the hips in. So when we have limitations in our legs and in our hips, you're putting additional motion in that lower back. Imaging regarding a muscle-related injury is more to rule out that there's anything else going on.
Usually I recommend ice as the treatment modality for muscle strain or sprain the first 48 hours. Beyond that, if heat provides more relief than ice, certainly that could be used to alleviate muscle spasm. Anti-inflammatories, non-steroidals is what we usually use. We usually do not go to a steroidal anti-inflammatory. Stretches and physical therapy can help as well too. We also at Coordinate Health have chiropractic care. However, usually I avoid it in the first 2 to 3 days after a muscular sprain strain, as you don't want to exacerbate the symptoms by any manipulation.
The idea is that our bodies work in concert. Our legs work well with our back, work well with our arms, and so on and so forth. And limitations in certain areas can really affect the other areas. So one of the most important things for us early on the diagnostic evaluation is to try and find out where are the limitations throughout the body that can affect the muscular injuries or other injuries to the lower back, and make sure that those areas are addressed. So when we talk about functioning, we talk about what do patients do? They bend over and they pick things up. Are there limitations with being able to do that in their hips? And then that's putting additional stress on their back and has created the problem. These are the types of things that we would want to work out, not only diagnosing wise in the exam, but then also addressing those things in a physical therapy program. It's really important for the patients to really understand what causes these problems. So getting an education about what their problem area is from their doctor, from their physical therapist, and then starting to move will help expedite the recovery itself. But in general, getting an exercise program that addresses these problem areas is going to be the most important, and doing the exercises the right way and safely, and progressing these exercises the right way and safely.
At home, patients who have a lumbar strain or sprain type condition can perform a regular daily stretching activity, stretch out their back extensors and their abdominal muscles and their side rotators, their gluteal muscles as well too. They can ice 15-20 minutes, 2-3 times a day initially. They can also use over-the-counter anti-inflammatories.